Okay, so now let's talk about seizures. We have how I want you to think of it as generalized and focal, big and small. Big meaning grand mal, tonic-clonic seizures affects your whole body. Small meaning more focal seizures, whether it's a twitch, a tic, a blink stare into space, or smaller areas that are affected by the synapses, abnormal synapses going on in your brain. So I'm not going to go over pathophysiology or anything like that. Small does not mean less serious, though. So this is just how it's easier to remember. With these two seizures, the main goal, or any type of seizure, because remember there's subtypes that come down from that, which was on one of your slides. The main goal is prevention, all right? Prevention. There's a lot of medications that are out there, but these are just one of the two, and the Keppra is the most common that's used now that I see out there. But just so you know about Dilantin, you need to know about Dilantin. It can cause sores in your mouth. It's used inpatient a lot for seizures through the IV, but it's for prevention. And you have to always get Dilantin levels, or phenytoin is the generic name, because it has a narrow therapeutic index, if you remember that from pharmacology. So you have to check levels and make sure that they're where they're supposed to be. Otherwise, it's not going to work if it's too low. But if someone's having a seizure, especially one of these, how are you going to abort it? Or one that's happening over and over and over again, status epilepticus. You want to abort it with Ativan or lorazepam, the benzodiazepine medication. So this hopefully can relax their nervous system and abort it. We want to be careful with precautions on how you're going to care for a patient with a seizure. So especially grand mal, how are you going to treat that patient as a nurse? You walk in and this patient's having a seizure in their bed. You're on a medical floor and they're having a grand mal seizure. So what are you going to do? You're going to make sure they're on the side, have suction ready, side rails up with pads on it, oxygen. We don't do tongue depressors or put anything or bite blocks or anything in their mouth like years ago. That's not good. So caring for that patient and safety. The overall goal is prevention, but then we have safety to worry about too. And that's all I'm going to talk about with seizures.